This segment of Delmarva Life is brought to you by TidalHealth.
We're taking some time today to do a little myth busting myths about your health. Let's say you're in a situation and you thought you needed care that you could only find across the bridge. Now, before you make moves and appointments, you'll want to pay close attention to what our next guest has to say. We'd like to introduce to you, and welcome back, of course, to Delmarva Life, Dr. Karen Barbosa, a breast surgeon with TidalHealth. Thank you so much for being here.
Thanks for having me back.
All right, so one thing that you've noticed, because you've been here about a year, right? Mm-hmm. There are a lot of cases of breast cancer on Delmarva.
Yes. I've actually been on the shore for 2 years.
Okay.
And when I joined TidalHealth and they found that the Delaware program, 2 of the top surgeons had been retiring and they needed someone to cover their breast program. I joined them, really excited because I wanted to bring new technology, research, change, and just revitalize what was going on the shore. But then I found out that it was a bigger task than I thought because there's so much unfortunate cancer that's out here. The good news is that we can help a lot of these women by finding it earlier, and that's what we did back in October, talking about breast cancer screening and having that as a critical part. But then we also wanted to talk about other things as well that we're doing out here.
Yeah, because I think a lot of people believe that they have to go across the bridge to get cutting-edge technology when it comes to breast cancer and any kind of cancer for that matter. That's not necessarily the case.
So I always chuckle because I feel like patients definitely need to follow their heart and follow their intuition in terms of, consumer respective to their care, meaning like if you need to get a second opinion, get a second opinion. But I think what's happening now since I've been here is I've noticed patients go over the bridge and then they come back. In a way, it's kind of nice for them to have that reaffirmation that they get the same recommendations over the bridge, but they can get that same care locally. And that's just amazing because having good care, quality care, or exceptional care close to home is quintessential.
Oh, absolutely. And one of the things that you teach is Oncoplastic Reconstruction. What is that?
So I know we kind of alluded to it a little bit in the past, but it is fusion of plastic surgery and cancer surgery. When you take a cancer out, having a mind's eye to the cosmetic reconstruction of the tissue to avoid deformities. There are places where you can get treatments for deformities fixed, but it's always harder, especially if they've had radiation. So the best plan is to try to avoid a problem by doing these strategic moves. And the American Society of Breast Surgeons has been teaching courses for the last several years, and I've been fortunate enough to be part of that teaching faculty.
Are there situations where a mastectomy can be avoided?
Yes, a lot.
Really?
Yeah. So the exciting part about how I actually got started was a patient when I was in Alaska came up to me and said, "You need to help me. Everyone else tells me I need to remove my breasts." And she had very large pendulous breasts. And I told her, I said, "Your cancer is large, but you're also the tissue we have to work with is large." So we did her reconstruction in the form of a reduction. So we took out a large amount of tissue as part of the reduction, got her negative margins, got her through her cancer treatment, and she had a more youthful, healthy breast tissue appearance. It's amazing. It's a win-win for patients.
But that has to be wonderful for them.
My favorite, and I might have mentioned it before, is when she said to me, "Dr. Barbosa, you said when life gives you lemons, you make lemonade. These are lemon drops." And it's amazing to empower these women because they're so scared and they're worried about their mortality and they're worried about their kids and their families and what this is going to mean. And then they get this life-changing makeover where sometimes patients actually look better after the reconstruction than before they had their cancer.
Yeah.
So it's really an amazing opportunity for patients, and they need to know about it.
Sure, sure. Now, I want to touch on some research, some other research that you brought to the shore on genetic testing, and I think you want to touch on it too.
Oh, yeah. So I am super excited. The Richard A. Henson Research Facility in Salisbury and I have been partnering, and they are part of the Johns Hopkins research program. And so we have a combined program where I am bringing out the IGAP Registry, which is hugely exciting for me because I've always been passionate about genetic testing and identifying a patient's genetic history before going to the OR. No one wants to find out after their surgery that they have a mutation that they might have been better served with mastectomy for prevention. So knowing knowing that up front can help direct the proper surgical care and at least give a patient an option to make an educated decision. And with this study, I'm hoping to go back and mine patients who've been treated years ago because they were never tested. And now we can reach out via media to get those patients to say, hey, if you haven't had genetic testing, you've been treated for cancer, come on over, be part of a study, pay it forward. The first study said that every woman, irrespective of age, should get genetic testing, and insurance companies listened. So this new study coming out is to get every woman who's high risk, every woman who just walks in the door and wants genetic testing. It's going to be interesting to understand what we can do for the community by just getting this study off the ground.
It's so exciting. TidalHealth's Dr. Karen Barbosa, thank you so much. I'm sure a lot of people are going to want to know more information. We're going to have some contact information on our website, delmarvalife.com. Thank you.
Thank you so much for having me.